but I swear it does connect to it does connect and relate to the work that we do in Kappa. And so I always present about talking about street food stands in a Mexican city. And so let's see. Hold on. All right, so this is a quick outline of the presentation. I'm going to cover the background, the theoretical framework. I'm going to present my research question, the results, and then I'll talk about some of the discussions and implications of my study and findings. So first, to start off, street food stands or street foods are defined by the United Nations Food and Agriculture Organization as ready-to-eat foods and beverages that are prepared and sold by vendors on the streets using a number of different mediums, and that includes bicycles, push carts, buckets. Sometimes they've just set up tables on the side of the road, on the sidewalk, and that's how they sell the foods. And another part of this definition that the United Nations didn't include, but it should be considered, is that street foods can also be prepared at home or in factories, and then they can be taken to the streets where they are sold or consumed. Street food stands are part of the food environment, and the food environment refers to the physical presence of food venues, the proximity to venues, the distribution of food venues, and the connected systems that either facilitate or hinder access to these food venues. And there are several limitations with studies of the food environment. One is that most of the studies have focused on high-income countries, primarily here in the US. And since they have focused on the US, most of the food venues that they have studied include places that we consider traditional here in the US, such as supermarkets, grocery stores, fast food restaurants, and convenience stores. There's research is missing on more culturally relevant food venues that are more representative of minority communities in the US and in low and middle income countries, and that includes street food stands. This is a review of research regarding street food stands from around the globe. And here there are three things to highlight. One, there has been an increased number of street food studies, with most of them happening in the past 13 years. Two, few studies have focused on food availability or consumption, which is the main topic that I'm interested in. And three, even a smaller number of studies have focused in North America or South America. Of the studies that I was able to find in Mexico, I found 7, and there are some limitations with those studies. One, they have used indirect or intermediate methods to document food availability. Some methods such as 24-hour recalls, they rely on a person's ability to recall what type of foods people ate. And that, of course, could be biased because the participants sometimes may not remember exactly what they ate. And the researchers in this type of studies are saying, okay, if their participants say that they ate this type of foods, and we ask them where, then if they say that they ate street food stands, then that's where they ate it, and that's how they are able to come to the conclusions, but that's not an objective assessment. The second limitation is that the studies have focused on one point of access, meaning the places that vendors may be targeting, and that strategy limits the results to that point of access. And in the case of these studies, they have primarily focused on what's around schools and how that affects what children are eating. And the third limitation is that the studies haven't used a validated or reliable assessment tool to capture the type of foods that are available at the street food stands. And so why is it important to study food venues? So food venues the food venues present in a community are associated with the type of food items that are available in that community. So for example, we know that fruits and vegetables are more likely to be found in supermarkets and grocery stores, and they are less likely to be found in fast food restaurants and convenience stores. And when they are found in those places, in fast food restaurants and convenience stores, they're typically more expensive. We also know the availability of fruits and vegetables has been associated with consumption of these healthy items, and that the consumption of these healthy items has been associated with disease prevention. It helps prevent things like obesity, chronic diseases, like type 2 diabetes and cardiovascular diseases. We also know that there are disparities in food availability and access. For instance, low-income and ethnic communities are less likely to have supermarkets and grocery stores nearby in the community. And we also know that there are disparities in health outcomes associated with that lack of access to some of those food venues. For instance, low-income communities have higher prevalence of obesity and are at a greater risk to developing chronic diseases. However, we do not know what is happening with street food stands. We don't know what's the relationship between street food stands availability, food availability, and health outcomes. And with my study, I'm trying to start that process of finding what's the relationship between the street food stands availability, dietary intake, and health outcomes. We need to understand the role that street food stands play in food availability so that we can understand the relationship with outcomes. And this is extremely important in the Mexican context, given the high obesity rates. So most recently, Mexico obesity rates were higher than those of the US for both adults and children. And obesity is a major public health concern given the close relationship that exists between obesity and chronic diseases like type 2 diabetes, cardiovascular diseases, and some types of cancer. For my project is informed by Glenn's model of community food environment. This is a sociological model that says that there are different levels of influence in the food environment, and each level of influence has variables that interact with each other to lead to certain outcomes. For this specific project, I'm focusing on the community food environment by looking at the type and location of the street food stands, and the organization of food environment by looking at the points of access. And of course, in the future, I would like to expand to the other levels, including policy, individual, and behavioral layers or levels. My research setting is Mexico City. I selected this location for its rich history of street food stands, and also because Mexico City is the largest urban city in the country and the heart of the Mexican economy. There's a high diversity of street food stands in Mexico City due to people migrating from all regions of the country and bringing with them their culinary experience. I use an assessment tool that I previously developed to capture street food variables. This tool has two components. It has the street segment assessment that looks at the type and density and distribution of street food stands, and a street food stand component, which assesses the type of foods available at the stands. For this specific project, I'm going to focus on the first component. And the variables there include the type of street segment, the income level of the neighborhood, the number and type of stands, and the point of access near the food stands. And by point of access, I'm referring to the different places such as schools, parks, work sites, transportation centers, places that street food vendors may be trying to reach to and find clients. My research question was, are there differences in street food stand availability, density, and distribution across income groups and point of access? The measures that I had in this project were availability defined as the physical presence of street food stands. And the question was, is there a type of stand present on the street segment? If so, what type of stand it is? And for that, I have four categories for the stands: cooked meal stands, snack stands, and fruits and vegetable stands, and other. The second measure was density, which refers to as the average number of street food stands per street segment, and then distribution, which refers to the arrangement of street food stands near the points of access or the places that the vendors may be targeting. For my sampling strategy, usually studies of the food environment, researchers have looked at business directories to draw a sample of the food venues that they're interested in studying, but that wasn't possible with street food stands since there isn't a directory available. And that's mostly because the street food stands are part of the informal economy, and many of the vendors do not have permits from the city to be able to legally operate on the streets. So I had to come up, my research team and I had to come up with a different strategy to find a sample of street food stands. And so we decided to focus on selecting a sample of street segments from which we could draw and potentially find street food stands. And in order to do that, we needed to first create observation areas throughout the city. And we did that by focusing on two strategies: one on census tracts and two on buffer areas. So to draw the observation areas, I first stratified Mexico City by income levels. As you can see in this map, is the smaller blocks are the census tracts, and they're color-coded by income level, with the red and orange representing the low-income neighborhoods, the yellow representing middle, and the green color representing high and very high-income neighborhoods. Once I stratified the city like this, I selected a sample of 5 census tracts per income level. Once I did that, once I selected a census tract, I identified the center point of the census tract, and from that center point, I drew a 400-meter buffer area. And one of the benefits of that buffer area is that it captures more than one census tract, or captures pieces of other census tracts, and that's it's a better representation of the food environment that people might be exposed to within their neighborhood. Once I had drawn my observational areas, I then went and mapped every single street segment within that observational area. And once I did that, I selected a random sample of residential street segments, smaller street segments, and then all of the arterial street segments. The arterial street segments are the bigger avenues and streets that you can find within the neighborhoods. After that, I'd assign the selected street segments to 3 time points for assessment: the morning, afternoon, and evening. And the main reasons for that is to be able to capture how food availability varied throughout the day. This is a distribution of the observation areas. You can see that we cover most of the city. We didn't cover the southwest area. That's mostly because it was marginalized. We didn't have, there's not a lot of population in this area. Most of the people are populated in central and north of Mexico City. So here's the breakdown of these segments that we assessed. We had initially selected 184 segments, but we only assessed 761. Of those, you can see here that most were found in high-income neighborhoods during the morning time, and most of them were residential street segments. We didn't assess 123 of the street segments due to the following reasons. One, we just couldn't find the street segment. Two, the street segment was part of a private neighborhood that we didn't have access to. And three, some of those street segments were in very marginal areas, and my research team didn't feel safe going into those street segments. Here's some of the pictures of the neighborhoods. Here on the bottom left, you can see a very marginalized neighborhood at the outskirts of the city. And then on the bottom right, you see more like a downtown Mexico City with a more urbanized area. So for the results, the cooked meal stands was the most prevalent with 38% of them. That was followed by snacks, fruits and vegetables, and then others. And then we saw the street food stands were least available in low-income neighborhoods. And it was the middle-income neighborhoods that had a higher availability of street food stands for the 4 types of street food stands. And that was statistically significant for cooked meal stands, snacks, and other type of stands. Now for the density results, we saw similar observations that it was the middle-income neighborhoods that had a higher density of street food stands. That was significant for cooked meal stands, snack stands, and other type of stands. For the distribution, here you can see that stands were more likely found near homes, followed by transportation centers, work sites, and food inns. And these categories are not mutually exclusive. You can, with the right conditions, you can find a street food stand in all of these places, but oftentimes that wasn't the case. But you can see that street food stand can be found near multiple venues or point of access. This map, you can see a buffer area or neighborhood of low income level. Here you can see that there's a high number of street segments, but in a high number of stands. But you can see that most of the stands are found along these 2 main streets, arterial street segments. And the main characteristics of those streets are the number of bus stops and metro or subway stations that are found there. So it seems that street food vendors are targeting transportation centers to be able to capture some of those daily commuters. In this other map, this is a low-income neighborhood. Here you see a much less number of street segments. Primarily, you see main arterial street segments, but there's a high number of street food stands. And the main characteristics of this observation area is the number of work sites. You have a hospital here, another hospital here, one more here, and then on the top, another hospital, and then one sporting arena. So with this map, it seems that street food vendors are also targeting work sites to be able to capture some of the workers who may need to grab a meal during the day. And now for the distribution of the stands, we saw that we only saw differences for cooked meal stands, snack stands, and other types of stands, with a higher distribution of cooked meal stands near food inns and high-income neighborhoods, and a higher distribution of snack stands near work sites in middle-income neighborhoods. Now I would like to move to the discussion. And first, I'm going to talk about the availability and variety of street food stands across the income levels. I had initially hypothesized that there will be a higher availability and variety of street food stands in low-income neighborhoods, but that wasn't the case. I believe that would be the case because two previous studies in Mexico, one an ethnographic study and a second one a historical report, associated the presence of street food stands with low-income communities and poverty. But that wasn't what my current studies suggest. They suggest that street food stands are no longer just, I think, of low-income communities in Mexico City. since we observe a high availability and variety of them in middle-income neighborhoods, and also they were also present in high-income neighborhoods. The results suggest that street food stands are a source of affordable, convenient, and cultural relevant food, and that also seems to be the case in Mexico. People from any income level take advantage of a affordable and convenient meal. However, the presence of street food stands in a community doesn't guarantee their consumption by members of that community. It could be the case that low-income community members are the ones eating street food in middle and high-income neighborhoods as they commute to work in middle and high-income neighborhoods, especially in downtown Mexico. It could also be the case that low-income community members are the ones selling food in middle and high-income neighborhoods. So there could be less of them in low-income neighborhoods because they are selling food in other type of income levels or neighborhoods. Now for the distribution near points of access, I hypothesize that there will be a higher availability of stands near places that attract a large number of people. And the results here show that street food stands were most often found near home, work sites, transportation centers, and food inns. Previous studies on street food stands also found that transportation centers and work sites are places where street food stands usually gather to find clients. And the result from my study can be explained by the fact that millions of people commute to work on the outskirts of the city or from nearby cities to downtown Mexico City, which is higher income neighborhoods. Some of them can spend up to 6 hours commuting daily. If you haven't been in Mexico City, just to travel a couple miles can take you 1 or 2 hours due to the highly congested street segments. So some of these people may not have time or the resources to eat at home, and so street food stands act as a mobile food source that can be conveniently located to facilitate access to food. The distribution of street food stands near the restaurants or food inns is something that I wasn't expecting, but it can be due to two factors. One, the hours of operation. Street food stands or street food vendors begin working before the restaurants open. These vendors can offer food for early commuters, and it is common to find tamales and atole stands in the early mornings, and these are items that people can grab and eat on the go, so they're easy to consume as you're traveling to work. The second factor is the cost of food at restaurants. Restaurants' food, even food inns, which are mom and pop shops, is more expensive or can be more expensive than street foods are. These higher costs may not be accessible for some people with limited resources. So it seems that street food stands may give people alternative food choices. Now for the public health and policy implications. There is potential to work with street food vendors on nutritional interventions. Some researchers have suggested that street foods could be fortified with nutrients that could benefit individuals in need, especially children. Also, the versatility and high mobility of street food stands could help bring healthy foods to areas in need. Street food stands can set up in open spaces. They can rotate locations throughout the week, and by doing so, they can help communities with limited transportation and mobility issues. We can bring the street food stands or the food to their neighborhood or near their home, so they can have easy access to them. It is also true that street food stands can be a source of a healthy food, especially with the availability of snack stands. But researchers and policymakers can work together to regulate street foods and beverages and encourage the availability and consumption of healthy food options. And the Mexican government has had some of major initiatives like this, including the added sugar tax and the junk food ban that were created with the goal of curbing the per capita soda consumption and junk food consumption in the country. Planners, policymakers, and street food vendors can work together to legalize street food vending rather than sanction them, which is currently encouraging the high informal nature of this business because local governments are not facilitating the legal status of the stands. For my future directions, future projects, I would like to explore the relationship between street food vending and health outcomes. I would also like to study the sustainability impact of street food vending on the local economy and the environment. And also I would like to focus on the occupational health, what type of conditions are vendors experiencing that might affect their health, and then look at the role of street food vending in community and economic development. Now I would like to tell you about my experience working with vulnerable populations. I have worked with a number of different populations in the past, mothers, children, low-income communities, but I can tell you that working with the street food vendors was one of the most challenging. As I mentioned before, street food vendors are part of the Mexican informal economy, and as such, many of the vendors do not have permits to work on the streets. Because of this, the vendors distrust anyone who come to their stands asking them questions about their stand. They are worried about the potential of losing their business and source of income. So the main challenge for me in this study was building trust with the vendors. Like, how could I get them to trust me and participate in the study? And for that, I have two answers. The first one is simple: be honest. Be honest about the goal of the study. In my case, I want to show that street food vending or street food stands can be a source of healthy food, and that can help communities with limited access to healthy foods. The second answer, which is even better, was to sit down and eat some of the delicious street food. And I ate a lot of delicious street food during my studies. And in my experience, the relationship changed considerably when I became a customer or another client. When I purchased food and sat down with them and eat the food, the vendors relaxed and were more willing to help when I needed the help. And they also were even more willing to help when they saw that my research assistants were students who were working on a project for their study. They were more friendly towards us and willing to help conduct the study. Now, I would like to talk about some of the justice issues associated with street food vending. Street food vending sits at the intersection of a few justice topics. The first one is food injustice and access to food. Article 25 of the United Nations Declaration of Human Rights and Article 11.1 of the International Covenant on Economic, Social, and Cultural Rights protect the right to adequate food as part of the right to an adequate standard of living. In addition, Article 11.2 of the Covenant affirms the fundamental right to be free from hunger. Under Article 11.2, countries should work on improving the ways we produce, conserve, and distribute food by taking full advantage of technical and scientific knowledge, and that is where we as researchers come in. Countries should also work on equitable distribution of food supplies with a special focus on regions with the greatest need. And street food stands represent a reliable source of food for millions of families in low and middle income countries. Some families with limited resources, especially low-income families living at the marginal sectors of society, may not have the materials they need to cook at home. They might not have a reliable source of fuel, safe running water, or other items that facilitate cooking at home. Some of these individuals might not even have the time to prepare food at home either because they commute long distances or work multiple jobs. For this reason, street foods can be a source of healthy food or food security for millions of people. However, local governments have had constant conflict with street food vendors. Many local governments do not see street food stands as part of the urban fabric. There have been many occasions when local governments have embarked on street cleaning initiatives to remove and eradicate street food vending. These have resulted, of course, in altercations between the vendors and the police officers, where products have been confiscated, stands have been destroyed or removed, and oftentimes vendors have been harmed and have lost their main source of income, sometimes their only source of income. Very few cities have policies that protect street food vendors. That could be because stakeholders believe that street food vending or street vending is a transitory activity and that it will go away with time, but that's not the case. Street vending has been around for decades and there are no signs of going away. In fact, there seems to be an increasing number of street vendors that has been associated with an increasing urban population and with economic uncertainties. When the economy goes down and people lose their jobs, oftentimes some of these unemployed individuals go into the streets to sell wherever they can to get by. Even then, many local governments refuse to make street food vending a legal activity, or in places where it's legal, like in New York, governments refuse to increase the number of street vending permits. This is a case in New York recently. They have street food vending is legal, but they only have a certain number of permits that they can hand out. And I don't know, I can't remember exactly how many years have gone by without increasing the number of permits. And of course, it has become more of a black market where some of the people who have permits ended up selling them at very high prices to those who need them. Also, vendors oftentimes do not have any benefits. A clear example of this has been the current COVID-19 pandemic. While many businesses here in the US have received some type of relief, street food vendors have been largely ignored. And these are people that are working, especially those who have permits to work. They're still not getting any type of relief from the federal or state governments. The last justice issue had to do with environmental justice. The nature of street food vending exposes vendors to environmental factors such as air pollutants and climate-related events. Mexico City is one of the most polluted cities in the country. Air pollutants can have several negative health outcomes, including eye irritation, dizziness, chest tightness, and upper respiratory symptoms. When I was getting ready to travel to Mexico City, my collaborators in Mexico City told me to make sure to bring eye drops because my eyes were going to be burning for a while, and that was in fact the case. So it didn't help that I wear contacts. And so that was also a big issue for me. Now, working outdoors also exposed vendors to climate-related events. As global warming continues to increase and temperatures continue to rise, street vendors are at great risk for experiencing heat-related conditions such as heat exhaustion and heat stroke. Special attention will be needed to address environmental justice for street food vendors, given that many local governments do not currently have policies to protect members of informal businesses. These are some of the issues or topics that I would like to address in my future projects. I would like to conclude my presentation by talking about our role as researchers. As researchers, we need to consider the principle of positionality and the role that it plays in every aspect of our research. For those of you not familiar with the topic, this term positionality refers to how differences in social position and power shape identities and access in society. In the case of research projects, how do factors that make us affect the way we see things, how we conduct research, and how we report our findings? We need to reflect on the degrees of privilege that we bring with us and how that may bias our research. We need to reflect on how that positionality will affect working populations, especially vulnerable populations. And in my case, here comes this highly educated American researcher with a research agenda that could have a negative effect on the livelihood of street food vendors, depending on what I ended up reporting. I had to reflect on the impact my project was going to have on street food vendors from the beginning, from the research design. In my case, I am advocating on behalf of street food vendors, so I believe that I'm having a positive impact on their businesses, since I want there to be more of them and to be legalized so that people can have a safe and secure food access, and also so that people who are selling food can have a source of income. I did mention that this was one of the most challenging projects that I'm working, and during my data collection, I witnessed a lot of poverty, mothers and children begging for money, looking in the vendors' trash for food that they could eat. I had the privilege to sit down to eat with the vendors and not worry about how I was going to pay for my food. And I even gave some of the vendors incentives for their help. That was a situation that made me feel guilty about what I was doing there. And yes, I could have easily purchased food for some of these needy individuals, but I also had to consider and be aware of how that will be perceived by some of the vendors who do not like to have beggars hanging around their stands because they think that they're going to be scaring away their customers. Ideally, research involving communities should be community-led. Researchers should be embedded in those communities to have a better understanding of the community's need, so that we can understand, or at least try to understand, the positionality of the community members we're trying to work with. Understanding and reflecting on that may lead to positive interactions with community members and the success of our research. And with that, I would like to conclude my presentation. Let's see if I can find you all.
Thank you, José Benito. That was fantastic. We have time for questions or discussion. I assume that that's something you're game for. So if anyone has a question or a comment, just raise your Zoom hand and that will pop you up to where José Benito can call on you.
Yes, sorry if I mispronounced your name. Rinjim?
Yes, thank you. Thank you. That was a very interesting presentation. I was wondering about the slide you had on intervention, and you suggested that one way to intervene through that nutritional route might be thinking about fortifying some of those foods. And I was wondering if that is another way of sort of co-opting that sector. And there are, in many communities, that's the way to legalize them also. But there are dangers to do that, right? And I was wondering if you could elaborate on that, and also on the food safety part, which I didn't see you talk about. That is one of the arguments often used against them.
Yeah, like I mentioned in that review, I would say, I think like 70% of the studies have focused on the foodborne diseases or aspect of street food vending. And that's, of course, that's one of the main reasons why local governments do not like street food vending, because they don't have I guess, the technology or resources to be able to have cleaning facilities. But I think that there could be potential work. Some of them, one of the things I was thinking, and I don't know if it has been done, is working with collaborators in engineering and other technology areas to be able to develop some type of I don't know, some device where it can help some of the vendors keep things either at the right temperature to sanitize the dishes that they're using, because that's, you know, like there's for instance, some of the vendors, to be able to keep things sanitized, they use a lot of plastic. They wrap their plates in plastic. When the customer is done, they just throw away the plastic bag, and that's having a big impact on the environment. So how can we do to make sure that we're helping the environment in that sense, but also helping the vendors keep things clean? And I don't know, I haven't seen that many studies that have focused on that specific part of how to keep things sanitized. But yeah, a lot of the projects do talk about the potential food contamination. But also it's hard to, with these studies, what they have done is they have gotten food samples and then go into the lab and analyze and see, okay, what type of bacteria is there. But there are very few projects that have focused on the foodborne disease, like found people who ate a street food stand and then they got sick. That's hard to track because, you know, like foodborne diseases, they take time to develop, and it's hard to say, okay, it was this specific stand or this specific place where you got sick. And that's one of the challenges. Now with the fortification, I only found a couple projects or studies that have talked about fortification, and they talk about how can we fortify foods, and that you could have in different ways. For instance, you can fortify food with the stews or in rice or on some of the food items. Of course, not all of them could be fortified, but starting with some of them, then we can build the case that yes, we can do that with food vendors, and yes, it could help some of the communities in need. But again, this is part of, I haven't seen a lot of projects, like I said, in the past few decade or so, the number of studies looking at street food vendors have been increased, but still up to date, most of them are still talking about foodborne diseases as opposed to like the nutritional aspects of street food vending.
Thank you.
I don't see any other raised hands. Yes, reservation communities. Oh, yes, that will be, I would like to also expand it to Southwest and work with other communities. So I started in Mexico City because that's where we have, I know that there's a high population or density of street food vendors that use not study well enough. But I know too, like in places like New York, Chicago, Las Vegas, in Los Angeles, there's also a high prevalence of street food vending. But I would like to also look at reservation communities because I'm not aware of the prevalence of street food vending there. But that's something I would like to start in the future. I think someone had a question. Paige?
Yes, thank you. This was so fascinating, and appreciated all of the broad context you put it in as well. So I know this is basically an unfair question because your work was completed before COVID began, but I'm curious about how, like, what you know about how things have changed for these vendors with COVID.
Yeah, I was dying to go back to Mexico during the COVID pandemic because street food vending is a very social thing. Like when you go into a stand, you see people pretty much elbow to elbow eating, socializing. And with the pandemic, that just couldn't happen or wasn't recommended because being in close contact with other people could expose you to COVID-19. I know that some places like New York and LA, they when had their stay-at-home mandate, they had to shut down. And in Mexico, it took a while, but some of them did. But still, like I said, since they're not even though they're informal and illegal, some of the police try to leave it alone as long as the others don't make a big deal out of it. Usually when vendors are removed from the streets is because owners of legal businesses like restaurants or other places, they don't want them on the street because they are saying that they are keeping the streets dirty, which sometimes is not really the case. But with the pandemic, I haven't had the chance to go back to Mexico. My collaborators say that COVID is still pretty bad over there in the city, especially because it's such a highly populated city. People are even just using the transportation systems like the subway or the buses over there. They just keep people in constant interacting with each other. And so even though they're trying to stay at home, many people still have to go out and work. And I don't know what the current situation is in Mexico, but that's something that I would like, when I'm able to go back, I would like to go back and do a retrospective study to see how the pandemic affect their business and themselves and the people that they know.
Kristen, did you have a question?
Yeah, thanks very much for this talk. I was wondering if you noticed how the vendors might have differentiated themselves based on their culturally appropriate food, like making the tamales the right way or from regional interests. And would that draw people to them more, or were certain places, were they able to gain an advantage around that? And how did they use that quality and desired cultural appropriateness?
Yeah, some of them do. Like some of them, you find like the food is typically the same. You know, have tacos it's gonna be the same thing throughout the day. Tamales is something in the morning. But within tamales, we have two type of tamales. We have the ones that are wrapped around corn husks or the leaves, and there's the ones that are in banana leaves. And those are more like we call them Oaxaca tamales. And you have people going around in their tricycles with loudspeakers saying that they're selling Oaxaca tamales. And that's how people know. And those are the main differences. For the other ones, they don't try to make them so different from each other. Usually, you'll see some differences in the preparations. For instance, when tacos al vapor, which are like steamed tacos, those are prepared at home in this big basket, and then they just wrap it and take them to the streets. You know that those are the type of foods that they're selling because they don't have anything to cook them. They just have that huge basket on their bicycle, and that's all they have. They have salsas hanging from the bike, and people go and eat those. And those are the main. If you know your foods, you know, okay, that person's selling that type of taco. This other person is selling this type of tamales. But that's the main thing. They don't try to do I guess I also wouldn't say like they don't do a huge job on making sure that they are different from each other. Just know like some of them are differences. I didn't see as much food from for instance, like the southeast Yucatan, Cancun area where they have cochinita pibil, which is a type of food item that is specific to that area. I didn't see that in the city as often. Michelle?
Good morning.
Morning.
My question is about the profit. Do you have any idea what the profit margin is for some of these vendors? Are they making just enough to maybe feed their own family and buy food and supplies to sustain the business? Or is it your sense that any of them have aspirations to maybe someday have a brick and mortar business?
Yeah, so I didn't have that in my tool, but I was through my conversations with them that I saw that for some of them, it makes a lot of profit. And so also some of the literature from other countries has suggested that some of the vendors, many of them come from low-income communities, and that's the only way that they can find to create some revenue for their families and sustain their families. For a lot of them, it's an intergenerational thing. One of the vendors that I talked to, he said that he graduated from UNAM, which is the main university in the city. And he was an engineer, but he gave up his career because he couldn't find a job. And two, his family they were making more money at the street food stand. And they had the stand for over 40 years. He was telling me that he has two of his kids were also at UNAM, and he was paying for education through the revenue that he was making at the stands. So for some of them, they are making enough money to sustain their family and to be able to send their kids to school with the hopes that their kids can get a higher education, to get especially a government job where they can be set for a good part of their life. It was interesting when I first arrived to Mexico City. I stayed at an Airbnb with a couple. They professionals. The boyfriend, he worked for the city as a lawyer, and the girlfriend, she worked for a Houston-based hotel company, so she could travel back and forward to Mexico and the U.S. And the first night I was there, I saw them preparing little baggies and yogurt cups with fruits in them, and then we started talking, and then I told them that I came to the city to study street food vendors, so street food stands, and both of them looked at each other and started smiling or laughing. They're like, that's what we do. Like they have businesses they're entrepreneurs. They have, I think, a couple businesses outside this big formal source of employment. They're not selling the food themselves. They're paying people to sell for them. So they prepare the things at home, and then they just distribute the items to the stands. And they told me that they're making money out of them, and these are highly professional individuals who live in a really nice area of the city, having their own stands. And I started to see that in some of the articles that I read, that some of the people with high income or highly educated individuals decide to leave the formal employment to go and start selling street food because they can generate more money. Even though some of the benefits may not be there, they still can make enough money to cover the living expenses.
Do you find that they use social media to drum up interest?
In Mexico, not so much. I think the social media is just is a recent thing in Mexico where they're trying to take that in their benefit and their own advantage. When I was going for my second trip, I don't know how my wife and I saw this social media post about this. It wasn't a street food stand, but it was more like it was a formal business selling these huge flautas, which are like fried long tacos, and they're supposed to be the best in Mexico City. And they're in a not so great area, but I made my way together to eat, and it's really packed. And but the street food vendors themselves, they're not using media yet to, or at least not many of them are using it to advertise. They usually set up in the same place. The ones that are a permanent locations or semi-permanent, they always set up there, and people know they are there, and that's how they find them. But yeah, I would like to study, see how media can help, and of course to see if any of them, because I know here in the US, a lot of the vendors, their goal is to eventually have some type of restaurant or even a food truck, which is a little different than a food stand, to be able to become more formalized and have a better source of income. But I would like to explore that in the Mexican context.
David,
Thank you. Fantastic presentation.
Yes, it was. David, did you want to ask the last question?
Sure, I put it in the chat, but I was wondering if you've heard of any efforts to tie the number or proportion of permits for vendors to their nutritional content, like for instance, providing some additional number of permits to vendors who sell fresh fruit or vegetables or other healthier options like that.
Not familiar with that in Mexico City, especially because a lot of the vendors are, again, not formalized. Some of them, like they go out and sell food here and there, and it's primarily as a way to generate extra income. But I do know of an initiative like that in New York City. They call it the green permits, where they release a new batch of permits to people who were going to be selling fruits and vegetables in areas with the greatest need, and that's how they increase the number of permits. But that was the main condition, that they will be selling healthy food. But I haven't seen that in other cities. But that could be an approach, and something that could be, like I mentioned in the implications, working together with other researchers and nutritional experts and city governments to be able to potentially encourage that. In Mexico, there's also a kind of like tianguis, farmers market. We call them tianguis, which is a group of vendors, street food vendors, that get together and travel. They're traveling farmer markets. So Monday they're here in Tempe on Priest Avenue, and then on Tuesday they're in rural, and they keep migrating like that, getting closer to different communities. And they're composed of people selling raw meat, dairy products. They're selling fruits and vegetables that are meant to be taken at home and prepared at home. And there's also people selling ready-to-eat food. And so they travel throughout the area, and you can see some of those kind of like vendors together like that, which is not something that we typically find here in the US. And when we do, they're more like farmers markets. But that could also be another way to kind of like link street food vendors with farmers markets and focus on maybe, okay, we will facilitate that process as long as you are selling food that is healthy for the people that need it.
Thank you. Interesting.
Thank you, everybody.